You're all good to go. I gave you the grand introduction, but you didn't hear it. So sorry about that.
No worries.
Okay.
I was like, yeah, can she see me?
Should be.
Are you guys able to see my screen?
Yes.
Yeah. All good.
Awesome, perfect. Okay, so hello everyone. My name is Priyanka Senthil, and I'm a member of the American Lung Cancer Screening Initiative, or ALCSI as we like to call it. And today we will be giving a presentation on lung cancer and lung cancer screening. And we are so grateful for the opportunity to present to you all today. So before I get into the content of the presentation, I'd like to share a little bit about what the American Lung Cancer Screening Initiative does. So ALCSI is a 501c3 nonprofit that works to raise awareness for lung cancer and lung cancer screening. And we are a team of over 50 passionate students and doctors located across the United States. And in the past, we've worked with community organizations like the South Asian Network and the American Indian Cancer Foundation, as well as city and state health departments, including the New York City and Connecticut health departments. And we hope that in educating communities about lung cancer and lung cancer screening, high-risk community members will be encouraged to seek lung cancer screening. And if you're interested in learning more about ALCSI, we'd like to invite you to visit our website at www.alci.org. And please feel free to email us with any questions at any time. So today we will be discussing both lung cancer and lung cancer screening, addressing questions such as how common is lung cancer, what is lung cancer screening, and how can you get screened? So to start things off, lung cancer is very common. It is the second most common cancer in the US, excluding skin cancer. And it is also the most fatal. So this graph shows the American Cancer Society estimates for the number of new cancer cases in the United States. This graph estimates that there will be about 228,820 people diagnosed with lung cancer in 2020 in the US. And to put this number into perspective, it is estimated that about 6% of all people in the United States will develop lung cancer during their lifetime. This means 1 in every 15 men and 1 in every 17 women will be diagnosed with lung cancer. I mean, this statistic is simply startling. Moreover, not only is lung cancer very common, but it is also very fatal, as I mentioned. And it is a leading cause of cancer-related death in the United States and the world. In 2020, it was estimated that lung cancer claimed the lives of 135,720 people. And this graph shows the American Cancer Society estimates for the number of cancer-related deaths in the United States. And as you can see, lung cancer is far more fatal than breast, prostate, and colon cancer. In fact, it causes more deaths than breast, prostate, and colon cancer combined. Every year, there are about 50,000 more new cases of breast cancer, but lung cancer still causes over 90,000 more deaths. And just to stress these stats even more, in women alone, every year lung cancer causes more deaths than breast, ovarian, and uterine cancer combined. Now, if we look at lung cancer incidence and mortality by sex and race, you can see that among males, lung cancer incidence is highest in Black males at an incidence rate of about 71.7 per 100,000 people. And among females, lung cancer incidence is highest in white females at an incidence rate of 44.7. And as we would expect, mortality rates mirror incidence rates. So Black males have the highest mortality rate among males, and white females have the highest mortality rate amongst females. So from this data, the question that arises is, why is lung cancer mortality so high? Well, lung cancer mortality is so high because patients are typically diagnosed at a later stage. This graph is looking at the proportion of patients with lung cancer by stage. Stage is simply a way for doctors to classify a cancerous tumor based on tumor size. If the cancer has, based on tumor size, whether the cancer is spread to lymph nodes, and if the cancer is spread to other locations in the body. So all these three factors are taken together to determine stage. And currently, most lung cancers are diagnosed at a distant stage, when the cancer is already spread beyond the site in the lung where it originated. This graph is based off of data from 2008 to 2017, published by the National Cancer Institute. And as you can see, about 21% of patients are diagnosed at a localized stage, while about 51% of lung cancers are diagnosed at a distant stage, when the cancer is already spread to other locations in the body. And we don't need to be surgeons or doctors or even researchers to understand that catching a disease in its earlier stages is going to be better than catching it once it has already taken over the body. And as we would imagine, catching a lung cancer early, it will directly impact survival, because the stage at which lung cancer is diagnosed correlates with the survival rate of that patient. And we'll see this in the next slide. One way that doctors track the survival of patients is by looking at the 5-year survival. And as you can see here, the 5-year survival is for lung cancer at the earlier stages is high, but the 5-year survival significantly drops as the disease progresses. And this graph is another way to understand the relationship between the stage of diagnosis and 5-year survival. The 5-year survival for patients with localized lung cancer is 59%, but only 23% of lung cancers are diagnosed at that stage. In comparison, nearly half of lung cancers are diagnosed at the distant stage. And this is why early detection of lung cancer is so important. If we can detect lung cancer at an early stage, then treatment options are better and prognosis is better. With lung cancer being such a morbid disease, some of you might be wondering then, why is the majority of lung cancers only diagnosed at a later stage? Well, the majority of patients are diagnosed at a later stage because they don't start feeling any of the symptoms of lung cancer until the cancer is already grown and spread. The most common symptoms of lung cancer are chronic cough, coughing up blood, chest pain, and shortness of breath. Additional symptoms may include hoarseness, loss of appetite, fatigue, persistent lower respiratory infections, and a new onset of wheezing. However, by the time people become symptomatic, for most patients, the cancer is already grown and spread to a point where it is more difficult to treat and the prognosis is poor. So if the diagnosis of lung cancer has to wait until patients finally start feeling the symptoms of lung cancer, then it's going to be difficult to catch lung cancer early. So the question we ask is, how do we catch lung cancer early if patients are asymptomatic? And one of the best ways we can do this is through lung cancer screening. Lung cancer screening is done using something called the low-dose computed tomography scan. If you're eligible for a lung cancer screening, it is recommended that you get an annual lung cancer screening test. In the coming slides, we will discuss what lung cancer screening is, who should get screened, and how to get screened. So starting with what lung cancer screening is, before we get into this, I want to make an important distinction between low-dose computed tomography, which is the CT scan, and chest X-ray. So both of these are two different tests. They're not the same thing. And we use low-dose CT scan because it provides more detailed pictures than chest X-ray. And it is better at finding small abnormal areas in the lung. So the picture on the left is a picture of a chest X-ray. The yellow arrows point to the abnormal area in the lung. But as you can see, it is unclear. On the other hand, the image on the right is a picture of a low-dose CT scan of the chest. And the red arrow here also points to the abnormal area in the lung. And as you can see, this image is much more detailed than the chest X-ray, and this enables doctors to see the abnormal area with much greater detail. And this becomes particularly important when planning surgery. So the question that researchers want to answer is, how effective is low-dose CT scan at detecting lung cancers at an early stage? And an important lung cancer screening trial called the National Lung Screening Trial, or NLST, tried to answer this very question. So the NLST was a large national study with over 50,000 patients. And the goal of the study was to determine the effectiveness of using low-dose CT scan to detect lung cancer in patients considered high risk for lung cancer. So the study included two groups. The first group of patients received annual low-dose CT scans, and the second group received annual chest X-rays. So by comparing the stage at which cancers were caught between these two groups, the study wanted to determine if the low-dose CT scan was better at catching more lung cancers at an early stage. And as you can see, of everyone diagnosed with lung cancer, the low-dose CT scan caught the most lung cancers at an early stage, while the chest X-ray diagnosed more patients at stage 4. And this has important implications for survival. Because the low-dose CT scan caught more lung cancers at an early stage, these cancers were more likely to be treatable, and the prognosis was much better. And in fact, this translates to a 20% reduction in mortality for those who underwent lung cancer screening using low-dose CT compared to a chest X-ray. A concern that with any screening test is accuracy. Essentially, how good is the low-dose CT scan at catching lung cancer? And for every 100 individuals undergoing CT lung screening, 75 of them will be negative for lung cancer. And of those 75 that are negative, 97.7 to 100% truly do not have lung cancer. This means that the CT scan is very good at identifying patients who do not have lung cancer. That is, if you do have lung cancer, the test will most likely come back positive and the test will not miss your cancer. So if we move our attention to the 25 individuals that are positive for lung cancer, 23 of them turn out to be negative for cancer, primarily through follow-up imaging alone. So this means that even if your test result is a false positive, it's still relatively easy to rule out cancer using further non-invasive imaging. And the two individuals that do have a positive test result and truly do have lung cancer are now more likely to be diagnosed at an early stage than if they were not to undergo lung cancer screening. So this means that, like we talked about before, their treatment options and prognosis are much better. So the results of the NLST were published in 2011, so about 10 years ago. And several studies have been published since then, further confirming the life-saving benefit of lung cancer screening. And one of these additional studies is the Nelson trial. So in February of 2020, the results of the Nelson trial were published. And like the NLST, the Nelson trial had two groups. But unlike the NLST, the Nelson trial had a group that received low-dose CT scans and a group that received no screening of any kind. So this study enrolled a total of 13,195 men and 2,594 women between the ages of 50 and 74, and randomly assigned them into two groups. So the CT screening group and the no screening group. And so those who were assigned to the CT screening group underwent screening 4 times over the span of 5.5 years. Specifically, they underwent screening at baseline, which is considered year 0, year 1, year 3, and year 5.5. So the results of this study confirm the life-saving benefit of lung cancer screening by low-dose CT, because in the screening group, 58.6% of lung cancers were diagnosed at stage 1, while in the non-screening group, 13.5% of lung cancers were diagnosed at stage 1, so a much smaller percentage of patients. And as we would imagine, this early detection translates to a reduction in mortality. In the low-dose CT group, there was a 24% reduction in lung cancer mortality in men and a 33% reduction in lung cancer mortality in women when compared to the no screening group. And furthermore, the Nelson trial also showed that with improvements in low-dose CT technology, the false positive rate could be significantly reduced. So it's clear now that lung cancer screening significantly reduces lung cancer mortality. But who should get screened for lung cancer? The United States Preventative Services Task Force, also known as the USPSDF, sets guidelines for who should be screened for lung cancer. And right now, they recommend that people between the ages of 50 and 80 years old and who have a 20-pack year smoking history or more, and who are a current smoker or former smoker who quit within the past 15 years get a low-dose CT scan annually. And the current screening guidelines, as we said, require you to have a 20-pack year smoking history. Now, pack year is probably a term that most of you have not heard before, but it's just a way for doctors to track a patient's smoking history over a period of time. And pack year is defined as smoking a pack of cigarettes per day for a year. So for example, if you were to smoke 1 pack a day for 20 years, that would equate to a 20-pack year smoking history. Alternatively, if you were to smoke 2 packs a day for 10 years, that would also equate to a 20-pack year smoking history. The important takeaway here is that there are many different ways to reach a 20-pack year smoking history, and a pack year is simply a way for doctors to keep track of a patient's smoking. And one thing I'd also like to point out is that the United States Preventative Services Task Force guidelines were recently updated. So the USPSTF had slightly different guidelines about several months ago. And were updated their screening guidelines in March of 2020, or sorry, March of 2021. And so the previous screening guidelines only recommended that individuals between the age of 55 and 80 with a 30-pack year smoking history or more get screened. So under the new guidelines, the lower age bound is lowered from 55 to 50, and the pack year smoking history is lowered from 30-pack years to 20-pack years. And so these new guidelines will nearly double the number of eligible individuals for lung cancer screening in the United States. And notably, the most apparent increases in eligibility will occur among women and minorities. So while these new guidelines will include more high-risk individuals, as you might have noticed, they only include individuals with heavy smoking histories. But as with many diseases, there are other risk factors for lung cancer such as environmental and familial risk factors that are not accounted for in the current screening guidelines. And these additional risk factors include exposure to secondhand smoke, exposure to radon, exposure to asbestos, a family history of lung cancer, COPD, and previous radiation therapy to the lungs. And so it is very important that we recognize these additional risk factors. And also it's important to raise awareness that while lung cancer has a strong association with smoking, there are still a large number of people in the United States who have never smoked that still get lung cancer. And never smokers are defined as individuals who have smoked less than 100 cigarettes in their lifetime. And because lung cancer has such a strong association with smoking, people are often surprised to learn that lung cancer in never smokers accounts for about 10 to 20% of lung cancer diagnoses. And it is the 7th leading cause of cancer-related death in the US and the world. So just to put this in perspective, more never smokers die from lung cancer each year than all people die from ovarian cancer. And this graph here shows a proportion of lung cancer cases that occur in people who have smoked in their life and people who have never smoked. And it is further broken down by whether they're a current, former, or never smoker. And as you can see, 80 to 90% of lung cancers occur in people who have smoked, but about 10 to 20% occur in never smokers. And interestingly, women are more likely to be never smokers when diagnosed with lung cancer. And in fact, in the US, 60 to 70% of never smokers diagnosed with lung cancer are women. So right now, the lung cancer screening guidelines do not recommend screening for individuals who have never smoked. And this is partially due to the fact that it's hard to quantify environmental risk factors for lung cancer and also genetic risk factors, unlike being able to quantify the number of packs a person smokes per day. However, understanding lung cancer in never smokers is a current focus of research. And with the development of new screening technologies and risk models, we hope that there may be a way to identify high-risk never smokers who should be screened for lung cancer. So in summary, lung cancer is the leading cause of cancer-related death in the US. And it is so deadly because most lung cancers are diagnosed at a late stage when the lung cancer is already spread to other locations in the body. And importantly, early detection through lung cancer screening by the use of low-dose CT can reduce lung cancer mortality by up to 33%. However, currently only 5.7% of high-risk individuals are currently getting screened for lung cancer. And to highlight really how low this number is, we compare lung cancer screening to the screening rates for breast, cervical, and colon cancer. And all four of these cancers have screening tests that are recommended by the USPSTF. But right now, only 5.7% of high-risk individuals are getting screened for lung cancer. So this rate is extremely low in comparison to the screening rates for breast, cervical, and colon cancer. And in fact, the American Lung Association estimates that if we were to screen every high-risk individual recommended by the USPSDF in the US, we could save 48,000 lives. However, because we are only screening 5.7% of high-risk individuals, this means that a lot of lives that could be saved through CT screening are not being saved. And some of the reasons for why the lung cancer screening rate is low, it includes limited awareness and concerns about access to screening, the cost of screening, and the safety of screening. So in the next slides, I will discuss each of these topics. But again, the important takeaway here is that lung cancer screening can help reduce an individual's risk of dying from lung cancer. So the first potential concern is the cost of lung cancer screening. The average low-dose CT scan costs anywhere from $300 to $400, but most insurance companies, including Medicare and Medicaid, will cover the cost for eligible patients. There are a few exceptions though, and one of them is that Medicare will only cover lung cancer screening until the age of 77. Two, not all state Medicare plans cover lung cancer screening. And three, patients will still have to pay the usual fees for provider appointments before or after the scan. And as I mentioned, unfortunately, not all state Medicaid plans cover lung cancer screening. And this is a map updated last July, which shows state Medicaid plans, or shows which state Medicaid plans do and do not cover lung cancer screening. So the blue states have state Medicaid plans that cover lung cancer screening. The purple states do not. And the pink states are ones for which we don't know this particular information. So the first step to getting a patient screened for lung cancer is having them talk to their primary care provider. There are certain questions a primary care provider has to ask and topics that should be discussed. And one of these is the patient's Pacquiao smoking history, which we saw how to calculate in earlier slides. And to find accredited lung cancer screening centers, patients can go to the American College of Radiology website, and they can type in the state or city that they live in to see where accredited lung cancer screening facilities are located near them. And the American College of Radiology website is listed on the bottom left-hand side of the screen. So as an example, this is a map of accredited lung cancer screening facilities in Massachusetts. And as you can see, each red pin represents an accredited screening center. And as far as how the experience of getting a low-dose CT scan goes, it will require the patient to lay on their back for about 5 minutes. And the patient will be doing something very similar to what the patient in the photo here is doing. And one thing to note is that this process does not hurt at all because it is a low-dose CT scan, so you're not using contrast. And so this means that there will not be any needles or injections involved. And the low-dose CT scan is non-invasive, fast, and as I said, completely pain-free. And additionally, the amount of radiation exposure during a CT scan is very low. And a way the doctors measure the amount of radiation a patient may receive is through a unit called the millisievert. And it is just a way to measure radiation and compare the levels of radiation received during different activities and over time. So for a low-dose CT scan, you will be exposed to 1.5 to 2 millisieverts of radiation. And this is a lot lower than a full chest CT scan, which requires a radiation dose of 8 millisieverts. So to put that into perspective, you are exposed to 3.11 millisieverts of radiation a year just from breathing cosmic radiation, eating, and radiation from the earth. So a low-dose CT scan exposes you to less radiation than you're exposed to from just existing on Earth. And this means that the level of radiation a patient receives from an annual lung cancer screening test is very small. But also, like that being said, if a patient is concerned about the radiation exposure, then they can always talk to their primary care provider to discuss this further. So once a patient has talked with their primary care doctor and the primary care physician has referred the patient to a screening center and they receive a low-dose CT scan, then what's next? The doctor will receive the results of the patient's screening test and will follow up with the patient to go over the results. And as far as results go, there are 3 most likely outcomes. The first outcome is that the scans are normal, and if that is the case, then the patient should look to get repeat scans in a year. If the scans are abnormal, but probably benign, then the patient should talk to their doctor about the next steps. And these steps may include more scans, tests, or biopsies. And if the scans are abnormal and suspicious, then the patient will most likely have to undergo additional testing, such as a biopsy. So lung cancer screening saves lives, but can we continue to do lung cancer screening during the COVID-19 pandemic? And is it safe to do so? During the pandemic, especially near the beginning, the number of cancer screenings did decrease significantly. However, lung cancer is not going to stop because of the pandemic. So if a patient is at high risk for developing lung cancer, it is still important that they get their annual lung cancer screening test. And right now, most hospitals have operating lung cancer screening programs, and patients can wear a mask during the entire process. So as long as a patient follows the necessary precautions, like wearing a mask, then lung cancer screening during the pandemic is safe. And the pandemic should not deter patients from getting screened for lung cancer in any way. And another question that we get often is, how is vaping and e-cigarette use related to lung cancer risk? And vaping and e-cigarettes are relatively new phenomena and have become more prevalent in the last decade, especially among adolescents and young adults. And while the long-term effects of vaping and e-cigarettes are still being studied, it is clear that for individuals who have never smoked before, they can increase their risk of lung cancer. And e-cigarette devices and vaping fluids contain nicotine derivatives and heavy metals, among other chemicals. And these arise as elements of the e-liquid and as a result of organic reactions in the electronic cigarette device. And various studies demonstrate in vitro transforming and cytotoxic activity of these derivatives. And vaping does cause fewer health risks than smoking, but it is by no means a risk-free activity. Vaping can increase heart rate, decrease air volume in the lungs, and increase airway resistance. And as I mentioned before, e-cigarette device use is increasing exponentially among young adults and non-smokers. So it is becoming a significant concern for the future. And additionally, while lung cancer screening has the potential to save many lives, it is important to address smoking cessation in the context of lung cancer screening. Lung cancer screening is not a substitute for smoking cessation. And likewise, smoking cessation is not a substitute for lung cancer screening. Smoking cessation is one of the best ways to prevent lung cancer, and lung cancer screening is the best way to detect lung cancer. So using both of these methods is the best way to fight the disease. And for like every year after an individual quits smoking, their risk for lung cancer is reduced by 8 to 17%, depending on the kind of lung cancer that they have. And another reason that smoking cessation is important is because it is required by Medicare and Medicaid services for lung cancer screening programs. But we do understand that smoking cessation can be difficult, and there are a lot of resources for people trying to quit smoking. And some great programs are the renowned Health and Wellness Quit Smoking Program and the Nevada Cancer Coalition's Quit Smoking Program. So as this presentation comes to a conclusion, I want to end on what we, the American Lung Cancer Screening Initiative, are doing to begin the widespread awareness, education, and advocacy efforts necessary to increase the lung cancer screening rate. So lung cancer is the deadliest cancer in the world, and while lung cancer screening can save a lot of lives, as we saw, very few high-risk individuals are getting screened. So we're working to address all aspects of this issue. And we recently wrote and advocated for House and Senate resolutions expressing support for Lung Cancer Awareness Month and early detection through lung cancer screening. And last December, our Senate resolution was passed by unanimous consent. Additionally, we're working to teach communities across the country about lung cancer and lung cancer screening. And lung cancer awareness starts really by working together to raise awareness in our own communities. And we believe that educating students about lung cancer and lung cancer screening is crucial to lowering the number of deaths because students greatly impact and influence the healthcare of their parents. So we hope that by educating students, we can also help their family members. So we are so grateful to have had the opportunity to present to you today, and thank you all so much for your time. We hope that you're able to leave this presentation with a better understanding of lung cancer and the lung cancer screening process. And as we know, it is a big problem, but there are tools that we can use and actions that we can take to help reduce lung cancer mortality. And ALCSI is always looking for help to raise awareness for lung cancer and lung cancer screening. And we host a variety of events related to lung cancer screening. And we share these upcoming presentations and webinars on our website. So if you have any questions, please feel free to send us an email. And if you're interested in helping raise awareness for lung cancer in your community, then we would love to work together. So thank you again for listening. And at this time, I will open the floor up for any questions.
Great, that was awesome. Thank you very much. Very eye-opening. I definitely texted my mom during that, checking on my grandma to make sure she gets screened. Does anyone have any questions? Yeah.
Does smoking weed increase your risk of getting lung cancer?
Were you able to hear that?
Yes, I was. It was a question, does smoking weed increase your risk for lung cancer?
Yes.
Okay. Yeah, so because smoking weed, e-cigarette use, and vaping are relatively new phenomena, there are still research studies being conducted, and a lot of these research studies will follow patients over a long period of time. So we're still learning more about how these behaviors might increase a person's risk for lung cancer. But because like vaping and e-cigarette use have harmful chemicals that that the person or patient then digests and is introduced into their system, it is thought that directly and indirectly, at least vaping and e-cigarette use has shown to increase a person's risk for lung cancer, especially if they are never smokers. And so it definitely is not going to be a risk-free activity.
Any other questions? Now? No? I had a question.
Yeah.
What got you involved with this organization, and how did you come upon it?
Yeah, so I was just looking for a research lab to join, and I've in the past been very interested in medical and clinical research, and so working more closely with patients and problems related to diseases that directly affect patients in the medical field that way. And so I was just looking for a lab, and I came across Dr. Chifu Jeffrey Yang's lab, and it was very it was just a coincidence really that I came across this lab. And before joining this lab, honestly speaking, I had very little knowledge about lung cancer and the problem, how big of a problem lung cancer really is. And so I knew very little about this. And as I've worked in the lab both on the research side, so conducting research on the incidence and mortality of lung cancer in different demographic populations, and also working with the American Lung Cancer Screening Initiative on outreach events and things like that. I've definitely developed a passion for lung cancer and raising awareness about it in the community.
I could definitely tell you know what you're talking about. Some of the stuff you're saying is just I would have never known any of it is happening. Yeah, it's pretty impressive, I feel like. Any other questions by anyone else? No? Does anyone know anybody with lung cancer that's had lung cancer? Yeah, I know I have, yeah. Cool. Okay, well, I guess we're good then.
Yeah,
I want to thank you again for, I'll come over here. I want to thank you again for coming by and presenting to us. That was really good. I appreciate it.
Thank you so much for the opportunity. It was a pleasure talking with you all.
All right.
Thank you.
Bye.